You wish, I think, to be addressed as Elaine.
I do, yes.
And this is your son, Oliver, with you, is it?
It is.
Well, welcome to the inquiry. Ms. Richards will ask you the questions in a moment once Mary has invited you to take the oath. Mary.
Please state your full name.
Elaine Reed.
Take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but
and
the
nothing
truth.
but the truth. Thank you.
Elaine, you're very softly spoken. I don't know if you could move a tiny bit closer to the microphone. Thank you. Now, you're here to tell us about the treatment of your son, Oliver. Oliver sits beside you, but we're inviting you to tell us about his treatment from your perspective as his mother.
Yes.
And he was treated initially at Alder Hey, and then at St George's, and then at St Thomas's.
Correct.
Now, before I ask you more about that, your background and training is as a nurse. When did you qualify as a nurse?
I qualified early 1978.
So, what area of nursing did you then practice in?
When I'd qualified, I worked in general surgery for some years, up to ward sister level. When Oliver was born, I had a number of jobs to fit round motherhood and schooling, and I became a district nurse, and about 15 years of district nursing. To get a better salary, I did go into the private sector, and I ran a nursing home for about 12 years as well. I finished my career as a specialist nurse in bladder and bowel dysfunction, where I used to run my own clinics and became an autonomous practitioner.
And did you ever work at Alder Hey Hospital?
No.
Did you work at the Royal Liverpool?
No, I worked at Southport Infirmary when I lived there.
Now, Oliver was born in 1983, and he has, and I'm sorry, I feel odd talking about you, Oliver, as if you're not there, but you're there. He has severe hemophilia A.
He does.
What can you tell us about how that came to be diagnosed?
I had gone to the Royal Liverpool Hospital probably a year before I even contemplated having a child, because my grandfather was haemophiliac, very mild. In fact, he was shot in the First World War. He was in the Rifle Brigade, and he was discharged on the grounds that he was a bleeder. That's all they knew at the time. So I thought it was pertinent to find out what my carrier status was and seek some medical advice. Dr. McVery, who I saw his name pop up earlier, he was the chappie I saw. He concluded that I was indeed a carrier, and the advice that I was given was that any child born to me affected with haemophilia would be as mild as my grandfather and probably wouldn't need treatment and certainly wasn't likely to be shot. So therefore, I went ahead with having a child with that knowledge. When Oliver was 5 months old, we were visiting family in Surrey, and he took great delight jumping up and down in his baby bouncer and on people's laps, amusing everybody. However, the night that followed, he was screaming all night long. Obviously something was amiss. I didn't know how to pacify him, but in the morning he was holding his left ankle up in the air and jumping on one foot. Wasn't right, so I took him to the Royal Surrey Hospital, and they x-rayed his ankle. They said to me, nothing wrong, and at that time I thought, that's fine, nothing wrong, he's probably sprained it or something. When he was 10 months old and walking at that time, the same thing happened, another night of screams, another morning of screams. And when I got him out of his cot, he wouldn't stand up on his feet. kept falling to the ground, and he wouldn't hold his little trolley to start walking. So I thought something's wrong again. This is a similar sort of thing. So I took him to Walton Hospital in Liverpool. By the time I got there, he was in the back seat, in the baby seat. His hand was like a balloon, which I hadn't seen before. So they x-rayed his wrist. They said to me, again, nothing wrong. And I thought, twice now, there is something wrong. So I said to them, I had been diagnosed as a haemophilia carrier. Could this have anything to do with it? And they said, well, it's possible. And I said, can I ask now for him to be referred to a consultant in haematology because I need this looking at. That's how I ended up at Alder Hey Hospital with Oliver. He probably was about a year old, and we saw Dr. Martin. During that consultation, he stripped Oliver off. He looked at him top to toe, examined him, and haemophiliacs have particular types of bruises that look like they've tented. And he said to me, he said, I'm ever so sorry that you've probably been misinformed by Dr. McVery. Your son, by looking at him, has got haemophilia, and I do need to do some tests, but my suspicion is now that it's not mild. If anything, it's moderate to severe. So with that information, we went home. About a week later, the phone rang. In those days, the landline in the hall. Oliver was playing in the hall nearby and answered the phone. And Dr. Martin said, we've got the results of the results, and your son has got haemophilia, and he has got it quite severely. I think at that point, I just lay on the floor, like somebody had hit me over the back of the head with a sledgehammer. This little one was just playing happily and looking at him. Life was changing from that point onwards. I can't remember much more about that conversation.
Now, Oliver was then treated at Alder Hey, I think from around that point in time, so probably late 1984 or thereabouts, would it have been?
Yeah, middle to late 84, yeah.
Through to about mid-1988 when you moved from the Liverpool area to the Surrey area. Is it right to understand that you don't have the medical records from Alder Hey or the treatment sheets, for example, sheets along the lines we looked at earlier today for Sue?
I have no idea what he was treated with because unfortunately when I did take him to Alder Hey, we were told to go up to a particular ward. We waited usually 1 to 2 hours, and granted it was a 17-mile journey from where we lived to Alder Hey anyway, and Oliver, by the time I recognised the bleeds, he was beginning to be in pain, so we had at least 2.5 hours of sitting with him distressed before somebody would come to the ward. The nurse would take Oliver from me. I wasn't allowed to accompany him into a side room where they proceeded to inject him. So I had no idea what they were doing other than treating his bleeds.
But your understanding, I think, is that he was treated with factor concentrates, with factor VIII concentrates.
That's what I understand.
Is this right? You don't know if they were commercial concentrates or NHS concentrates or a mix at that time?
I didn't know it existed. I just knew that treatment for haemophiliacs was factor VIII, and I had no idea that there was an option of where that factor VIII was made or where it came from.
And did Dr. Martin or any other doctor or nurse or anyone give you any information about the potential risks of transmission of viruses by that treatment?
Never. Never.
And was the option of cryoprecipitate ever discussed with you?
I didn't find out about cryoprecipitate until I read the booklet by, was it Peter Jones? And there was a section in that, but that's when we were all concerned about treatment and AIDS, I think.
So I think it follows from what you said that neither hepatitis as a risk nor HIV as a risk was something that was ever explained to you by any of the staff at Alder Hey.
No, Factor VIII was sold to me as the saviour.
Now, there's an incident you describe in your witness statement about Oliver bleeding and you having to rush him to Alder Hey, and then him continuing to bleed after treatment. Can you tell us what happened then?
I had decided at an early stage in this saga that I would keep Oliver's diagnosis private to myself and the family, purely because I wanted him to grow up with all the knocks and bruises that a normal child would have. And I was visiting a friend of mine, a good friend of mine, in Surrey, and her child and Oliver clashed, and he fell on the other child's head and pushed his teeth right up inside his gums. That caused a great deal of bleeding. I talked a load of nonsense to my girlfriend, trying to sound professional and knowledgeable, that it looked worse than it did because she knew nothing about the problem. It was saliva that made it look profuse. And the following day I excused myself, packed up all the bloody bed linen and clothes and drove 4 hours back to Alder Hey to get him treated. We waited the mandatory 2 hours in the ward for somebody to come up, take him off me, going into the treatment room. He's screaming. They hand him back to me, soaked with sweat. And then I go home. The second day, the blood started again. The gums were absolutely engorged with blood. So we do the same again. I drive 17 miles to Alder Hey, wait. He's injected, they give him back to me. By the 5th day, I was like this. I couldn't understand why nobody could stop the bleeding. And I grabbed, I don't know if she was a nurse or a sister, because there was never ever a doctor to speak to. I grabbed the sister and I said to her, "What is happening? Why can't you stop the bleeding?" And she said to me, "Well, are you giving the tranexamic acid regularly?" And I said, "What regularly?" And she said, "Well, if you don't give him something that holds the clot in the mouth, he'll bleed forever." So I just lost my cool at that point, and I just stood in the ward and demanded that they send somebody up to me. They tell me how to look after him, tell me what I've got to do, and they did, and I never went back again for treatments. It's quite an undertaking, and in retrospect, nobody checked up on me to see if I was doing it, or if I could do it. I just took over his treatment from that point onwards.
Now, you moved away from the Liverpool area in, I think, it was July 1988 or thereabouts?
Yes, yeah.
So prior to that, Oliver was still under the care, notionally at least,
Yes,
of Alder Hey.
We did see him. We did see him towards I think it was 1988, because it was in an outpatient's appointment. Oliver wasn't well. I can't tell you what was wrong with him, but he was listless. He'd lost interest in food, and he was unwell. And I really believed and kept it to my fears to myself, but I believed that he had been infected with AIDS. So I made an appointment to see Dr. Martin, but I never mentioned my fears to him, and he never suggested that that might be indeed a diagnosis. So I just talked about the lack of appetite, etc., and he had a bloated tummy and he was just listless. Anyway, he did some investigations, barium meal, and then I got a letter from him afterwards to say the barium meal was negative, and by the way, he's HIV negative as well, basically. I hadn't even known that he had considered it a possibility. I don't know if you've got that letter.
We have got the letter. I'm just trying to work out what the reference for it is. Lawrence, could you try WITN 4142004? That's it. So 23rd of June 1987, and it's redacted because originally, Elaine, your evidence was going to be given anonymously.
Yeah.
So, but this is the letter, and I can confirm underneath it refers to Oliver. Just to confirm that Oliver's recent barium meal X-ray was entirely normal, and then his HIV test was also confirmed as negative. So you hadn't known that Oliver was being tested for HIV?
No, it was a fear that I kept inside me, but it wasn't discussed, so that was somewhat of a surprise, because he must have been thinking on the same lines as me, but not discussed.
Do you recall in that period whilst you were still under the care, Oliver was still under the care at Alder Hey, so from 84 to 88, do you have a recollection of how often, roughly, Oliver was treated there before you decided to take over the treatment yourself?
Do you know, I don't. I think when he was very little, he wasn't weight, it was the weight bearing that caused more bleeds as he got older. So I don't think it was more traumatic injuries from falling and things that I don't remember. Sorry.
Do you remember learning that other children, haemophiliac children, treated at Alder Hey had been infected with HIV?
No, we kept ourselves very much to ourselves because it was our secret, and I didn't. The only thing, it wasn't so much children, but I did belong to the Haemophilia Society, and the bulletin, I can remember the obituary getting bigger and bigger over those years, but I was trying to push it to the back of my mind and get on with life.
So you then moved to Surrey, and Oliver came under the care of St George's, and I think Dr. Bevan was the consultant at that point in time. Did you then continue with the administering treatment yourself?
Yes, I did, yeah.
One of the things you've mentioned in your statement was, I think it was NHS treatment by then, BPL product that you were being given to give to Oliver.
Yeah.
And you recall seeing written on the bottom of the bottle or on the packet or somewhere that it's been heat treated but couldn't be guaranteed free of HIV.
Correct.
And that was something that you were very conscious of every time you administered a treatment.
I used to hold the bottle in one hand while I was pushing the medicine into his vein with the other hand, just hoping that this wasn't the one. It was
Difficult. You told us that at Alder Hey, you weren't given any information about risks from the factor concentrates.
no.
When you started getting the product from St George's, were you given any information then that you can recall?
Because Oliver was having a lot of trouble with his left ankle, Dr. Bevan wanted to put him on prophylaxis, and that's when we changed over to Monoclate P, and I understood, although I can't remember conversations, I understood that Monoclate P was a better product that had less risk. I knew about the risks. I knew about it from my own reading and wanting to give him the best care. So I knew that the monoclate P, and we had the discussion that it was a better product, cleaner.
Now, there came a point in 1992 when you were told by, I think, Dr. Bevan, that Oliver was hepatitis C positive. What can you recall about the circumstances in which you learnt of the infection?
He obviously had to have blood tests frequently. I don't think I ever knew exactly what they were doing. I mean, it could have been full blood count using it. It could have been a multitude. I don't think I remember exactly what they were testing for. So I think it came as a surprise. It was a surprise to find that he was hepatitis C positive, and a shock, but I can't remember if there was any discussion specifically about it before. Dr. Bevan and I had a nice relationship, almost on a healthcare level. I felt more of a nurse talking to him than I did a mother. So, but I can't remember being advised about it.
And we do have a letter from March 1992, which gives the test result, WITN 11940003. We'll go to the next page. So we can see it's from a Dr. Rowley. It's dated the 13th of March 1992. It's from St George's, and Dr. Rowley is described as a senior registrar. And then it just says, following our telephone conversation in January, I'm writing to confirm that the HIV antibody test on your son, taken at the end of November, was negative. The other tests performed on this sample were to check for his hepatitis B antibodies, and this shows that he's made a good response to hepatitis B vaccine and does not for the time being need a booster. And then the sample also showed that he was hepatitis C antibody positive. And then there's reference to an appointment in the paediatric haematology clinic. Oliver was about 8 at this time, I think.
Yeah.
So do you know now whether the letter was the first information you had about the hepatitis C test result, or whether you heard it from Dr. Bevan directly, or can you not remember?
I can't remember. However, because of the relationship Dr. Bevan and I had, I think we must have discussed that in order to move on with different products, screening had to be done, whether it was specifically told to me what the screening contained, but screening, and I probably understood what he meant rather than being told. That makes sense.
You've said in your statement that the conversation you had with Dr. Bevan was very matter of fact, and you weren't given any information or advice to understand and manage the condition. I understand that you weren't particularly meaning that as a criticism of Dr. Bevan.
No, I think it was more that he understood that I had made myself knowledgeable about the condition, and I had an underlying knowledge of hepatitis C anyway, and how to manage it, and what to do about it, what I could do about it.
Now, you tell us in your statement you then tried to make yourself an expert in hepatitis C to find out as much as you could and to work out how best to look after Oliver and give him the best opportunities. But before I ask you a little more about that, what was the impact on you of learning that your son had this condition that you knew from your nursing background was a serious one?
I was frightened for him, frightened for his future. I was frightened that he would develop a liver cancer, and I was frightened that it would damage his liver in some way and that it would threaten his life.
And I think from your statement and Oliver's, you threw yourself into doing everything you could to try and give Oliver every possible opportunity that you could.
Yeah, I took him to, when I worked at Epsom Hospital, I used to work with a registrar that since became a homeopath. And I know it seems cranky, but he was a physician. He had his MRCP. So he had his own practice in Guildford, and I took Oliver to see Dr. Lockie, and he wasn't a cranky homeopath. He gave me advice on diet, general advice on how to help his immune system overcome viruses. I don't know if it did any good or not, but I felt as if I was doing something. And I just to make sure that Oliver had everything that I could possibly give him: good food, good rest, fresh air, everything possible, and yeah, everything.
Now, around this time, early 1990s, Oliver's haemophilia care transferred to St Thomas's.
Yes.
And that was because St George's they were having problems with addressing a particular problem with a joint and the bleeding into that joint.
Yeah, his left ankle, which has always been the target joint, it was bleeding uncontrollably. Sometimes I was giving him his factor 8 twice a day. He was on crutches, he was in a lot of pain, and it just seemed to go on relentlessly. I didn't keep that to myself. I was back and forth to St George's all the time, seeking some advice on how we're going to progress with this. And eventually I was talking to colleagues of mine, and they said that St Thomas's had a specialised unit, and if you wanted the treatment, the creme de la creme treatment, that's where you ought to go. So I asked Dr Bevan if he would refer me to St George's, where we met Professor Savage.
Oliver wasn't offered treatment in the 90s with interferon. He was a child still, and so he never experienced some of the horrors of treatment that the inquirers heard about. There came a point at which you learnt he'd cleared the virus.
Yes.
When was that? Can you recall, and how you learnt that?
It was, I don't know that I can't remember him having a test, but it must have been at St Thomas's, because Dr Savage always talked about loading him up with factor 8, but a clean version. He called it a clean factor 8, and he needed to be virus-free to have it. So I can only assume that it must have been done at St Thomas's, because he wouldn't have had the clean product unless he was virus-free. But I can't remember him actually having a test.
As far as you can recall, again, whilst Oliver was still a child, did he continue, although he was regarded as having cleared the virus, did he continue to have regular checks in relation to liver function?
That I can't answer that. I don't know.
And into adulthood, do you know? And if you need to look to Oliver for an answer, please do.
Well, since he's been at St Thomas's, I can actually say that no stone has been left unturned. We were given expert. Dr Savage himself is a man on his own. He had a wonderful relationship with Ola right from the get-go. We went to joint clinics with physiotherapists, orthopaedic surgeons. I couldn't fault the treatment at St Thomas's. It was, and he's had blood tests. They've looked after you absolutely superbly.
Now, if we just look at one other letter in 2004, WITN 141194004, if I can read my handwriting correctly. Yeah, 1194004. Let me check. I've got the right reference. go to the next page. So this is a letter, September 2004, from St George's, referring to VCJD. And if we pick it up in the third paragraph, and this was a letter addressed to Oliver, who is now a young adult. Because in the past you received some clotting factors made from pooled UK plasma donations, you may have an additional risk of acquiring VCJD. The risk is called additional because anyone who ate UK beef products during these years is assumed to be at a low degree of risk of developing VCJD. So any risk of UK plasma products is in addition. And then there's reference to an attached information pack. And then it says this: after you've read the information, you'll need to decide whether you want to know if you received any batch of clotting factor known to contain plasma from individuals who later developed VCJD. You and Oliver discussed the letter with you, he decided, after the two of you had talked about it, not to be told if he'd received any such batch. Is that right?
Correct.
And that was, as I understand it, because there wasn't a treatment, there wasn't a test for VCJD, so it didn't seem to be useful to know. Is that right?
Yeah. And I think we had the discussion that because they were talking about it was an additional risk to somebody that had been eating meat, because we have always had a plant-based diet, we didn't see it was an additional risk. We thought we would be the same as anybody in the population, so we didn't pursue it.
But a consequence of the theoretical exposure to VCJD, I think, became apparent when Oliver had was it a cycling accident in 2010? Well,
it wasn't a cycling accident. It was Oliver, by this time, was living in his own property with his girlfriend, and I was on my way to work, and I got a phone call from him, and he said to me, I was out on my bike and I was really dizzy and I fell off my bike. And I thought, well, that's strange, just being dizzy and falling off your bike. So I remember being at a particular point in my journey to work, where either I could turn right or I could turn left, and I thought, something's wrong. So I went to his house, and when he opened the door, he was as white as a sheet. And I said, what's going on? And I did ask him about his toilet, and then it was clear that he must have been bleeding internally. So I think we gave you some Factor 8, and off we went to, as Jeff Savage always said, whatever the problem is, fill in with Factor 8 and then think about what the problem is. So we did that, got him into Epsom Hospital, and he was admitted eventually onto a ward, and we were told that he would have an OGD, a gastroscopy. So we waited and waited, and I think you were there for a couple of days, if not 3 days, we waited, and the OGD never materialised. So I actually knew the consultant because I'd worked with him in the past. And when he came in, and I said to him, what's the issue with the gastroscopy? We need to have a look down and see what the problem is here. And he said, oh, we're going to transfer him to St Thomas's. So I said, why? You do them here. And he said, it's to do with his viral status. We need to transfer him to St Thomas's because they've got a special set of scopes that they use for people that have got viruses. Well, I couldn't believe it. So I said, well, he hasn't got a virus. Whatever, I didn't know what on earth had been written in his notes. And I said, but he's not going to St Thomas's. He's going to have it here, which he did. And he had 4 bleeding ulcers and Helicobacter. So...
reading your statement and Oliver's statement, Oliver's statement, I think, possibly conveys to us that because he was able to clear the virus, perhaps the greatest impact of what you've told us and what your statements describe fell on you, because you lived for a number of years with the fear of your child may have been infected with HIV, then knowing he had been infected with hepatitis C, not knowing whether that would be one of the small number of cases that cleared or the rather greater number of cases that became chronic. So the greatest burden, the sense that Oliver's statement gives, was experienced by you as his mum.
Well, it was my job to protect him. So, yeah, I wanted to take the load because he had a life to live. Yeah.
And although you had, from the sound of it, a better experience at St George's and a better still experience at St Thomas's in terms of the relationship with doctors, the provision of information, at Alder Hey, would it be right to understand that you were given no information about the risks of treatment, no alternatives, and indeed, as you've told us, you weren't even allowed to be present when the treatment was being administered to Oliver?
The whole experience was horrendous. It was bad enough receiving the diagnosis. It was bad enough seeing your child in pain. It was bad enough knowing that he needs intravenous injections from somebody that is just called upon to do it and then walk out and have no communication with the mother whatsoever, or anybody show me any compassion or any care, really. If it wasn't bad enough, the fact that that medication could actually kill him was a lot to take on.
And you've given us some examples, both in your oral evidence and in your written statement, of times when you've essentially drawn on your nursing background to challenge or stand up to consultants, doctors. You've also given us an anecdote, but a rather powerful one in your statement, of an occasion where you had to stand up to a consultant who thought you were standing on his side of the bed. Just because, although that's unrelated to Oliver's treatment, it gives a snapshot perhaps of the role of the doctor. Could you just tell us about that?
Well, we're talking about probably 1979, 1980, when ward sisters were in charge of their ward, and the nurses and the domestic staff and the orderlies. Nobody coughed without me knowing about it. If we had empty beds overnight, we would have, and there was, for example, on this occasion, a patient who was under the care of the orthopaedic surgeons, and there was no bed in orthopaedics. They would lodge on somebody else's ward. Then the next stage would be to communicate with the ward sister, with the orthopaedics, and transfer that patient back to their appropriate ward. However, this orthopaedic patient stayed in my ward longer than we would have liked. And then the consultant, who was very old school, he arrived with his entourage of housemen, registrars, dietitians, physiotherapists, loads of them just came onto my ward. So I went to the bed of the patient with the notes, as the sister does, pulled the curtains round, and all of a sudden, everybody went silent. And they're all looking at me. And I didn't know what was going on. So then the consultant, nearly said his name then, the consultant said to me, "Sister, you are standing on the wrong side of the bed." Well, what a load of nonsense. Sorry. So I said to him, "May I remind you that you are actually standing on my ward, and I will stand on whichever side of the bed I choose to. Thank you." Well, I saw the faces of everybody standing around me that I was about to die. But however, he backed off, carried on, and left the ward. But that was the sort of ward sister I was. I wasn't going to take any nonsense from anyone.
And my last question is really just whether you have any observations drawing on your experiences both as a nurse and as a parent. Do you have any observations about the doctor or health professional and parent-patient relationship and the extent to which you observed it change or not change over the years?
When I was at Alder Hey with Oliver, I was vulnerable. By the time we got to St George's, I felt that I was comfortable challenging his treatment, comfortable being in charge of his treatment, and comfortable putting my hand up and asking for help if I felt it was beyond my capabilities. I had a role of parent and mother, and there was a defining line between the two, because I was a single mum with Oliver, so I had to discipline him, treat him, so I had to have lots of hats. It wasn't easy, but I think I did all right.
And so even with your nursing background and with the ability you've described to us in your professional capacity to be able to stand up to the old school consultant, even with those characteristics that many parents wouldn't have had, at Alder Hey, you were still not able to you were still not provided with the information, advice and support that you would expect to be given.
I think I was in a state of shock. I had to assimilate the information bit by bit, and I think primarily I did that on my own, by researching it, and I can remember actually getting to the point where I'd got it in my head that this was awful news. I was going to deal with it. I knew how they treated it. I need to learn how to recognise the bleeds. I need to get him treated, because that's the only way his joints will stop being damaged and for the rest of his life. And I think I just got over that hurdle when the AIDS advert came on the TV, and that knocked me for six again. So I think at that time I was just living day to day, coping and managing, and I think that made me very vulnerable, and I wasn't supported or by anybody.
Elaine, those are the questions I have for you. I'm just going to check with Mr. Snowden if there's anything further. Just one point of detail. When Oliver was under the care at Alder Hey, in terms of the concentrates, was there ever a point at which you were treating him at home whilst he was still at Alder Hey? And if so, where did you collect the concentrates from, Alder Hey or Royal Liverpool?
Yeah, I treated him at home from that mouth injury from that point onwards. So that would have been when he was 3, and we left to, so that was 1986-87, and we left Liverpool to go down south July 88. So during that time, I used to go and, I think I collected the carrier bag with the Factor 8 from the ward.
At Alder Hey?
At Alder Hey, yeah. So there was quite a time that I treated him myself before we left Alder Hey.
Thank you.
Yeah.
So do you have any questions?
Yes, I do. I'm fascinated, interested by your description of standing up to the consultant. It's expected, at least expected of the old-fashioned sister, which is what you were describing yourself as, albeit talking to the old-fashioned consultant, that the nurse would be the patient's advocate.
Yes.
And therefore you'd expect a nurse of anyone to take a rather different view and challenge the doctor when the doctor needed to be challenged, as you did.
Absolutely.
Do you think that attitude, that approach has changed over time?
Oh, yes.
And how?
I think we were probably 1982 when the training around that time started changing. There were less students on the ward. The hierarchy changed completely. The ward sister was now moving into budgeting the ward. More trained nurses on the wards had a section of the ward to look after, whereas in my time, the ward sister knew everybody on the ward. I think it was discipline and hierarchy that seemed to go out the window.
Does that mean that the patient doesn't have the same effective advocacy?
I believe so, yes.
So how best, or who speaks now, as you would see it, as the patient's advocate?
I think the family have to speak up for the patients.
That's asking an awful lot of
It is.
families.
It is indeed. It is indeed. But you see it if you, I'm sorry to, when you go to hospitals now, you see it with your eyes that there are, you could be visiting one person and you could look round the other 5 in the ward, and there would be enough work for me to deal with them as well, because they seem to be left with nobody to speak for them. It's a tragedy.
Thank you.
Elaine, do you have anything you'd like to add?
Only in as much that even though I am a trained professional, I've always seen doctors have got a very different job to a nurse, and we work side by side. But I've always expected to be trusted by my patients. So if I arrived at their bedside with a treatment, I want them to trust that what I'm giving them, doing for them, is correct and thought through, and I'm not putting them to any harm whatsoever. That trust is from the prescriber. I trust the prescriber that he or she knows what they're doing, and surely the prescriber has to trust the scientists and the pharmaceutical companies so that they in turn make sure that whatever is being cascaded down to the patient is not going to do them any harm. And this has rocked me to the core. Rocked me to the core. It's unforgivable.
Thank you.
I've got one further question, but it's not for you, Elaine. It's actually for Oliver. And it arises out of something you said. But it's very obvious to anyone who's looking at you on the screen that you have a shirt on which says Rugby Club, North Harrington. Did you or do you play rugby?
Am I under oath?
No, you're not.
No, I was never allowed to play rugby, I'm afraid. I was with the naughty kids who didn't bring their kit. So, no, I wasn't allowed to play rugby.
So why the shirt?
It was a gift.
Ah. The reason I asked was that this is for you, Elaine, really, that you said in evidence, my job is to protect him. I wanted to take the load so he had a life to live. And you see how that fits with my earlier question to Oliver. Can I thank you for being here as part of that protection, no doubt, particularly since you were at one stage wanted to be anonymous, and so it's not easy. And there was one moment when you managed to show some emotion when you were describing hearing about the hepatitis diagnosis. Otherwise, you put a remarkable face on things. But thank you very much indeed for coming to give evidence. And reflecting, as you in particular have been able to do, upon what it's like to be, on one hand, a mother, on the other hand, a nurse. So thank you.
So that completes the evidence for today, sir. Tomorrow we have a panel looking at the experiences of those from minority ethnic communities. We have, I think, 4 witnesses. I'm not going to give the names because I'm not 100% certain on the position in relation to anonymity in relation to one. I don't think anyone's anonymous, but I don't want to inadvertently say something I shouldn't.
So
we will have their evidence tomorrow.
10 o'clock.